Hello, and welcome to the Pharmacy Times News Network. I'm Nicole Grisano and your host for our Pharmacy Week in Review. New findings suggest that pregnant mothers should ensure they are receiving enough vitamin D, as inadequate levels could be detrimental to the development of social and motor skills of young children, according to reporting from the American Journal of Pharmacy Benefits. The study found that pregnant women who were deficient in vitamin D were more likely to have children with low scores on tests for gross and fine motor development at age 2.5. In addition to the physical effects, vitamin D deficiency during pregnancy was also linked to poor social development in children at age 3.5. These results suggest that pregnant women should ensure that they are getting enough vitamin D through diet, sunlight, and supplementation for proper development for their children. FDA officials have approved a new formulation of injectable suspension for adults with type 2 diabetes whose blood sugar remains uncontrolled on one or more oral medicines in addition to diet and exercise to improve glycemic control, according to a report on PharmacyTimes.com. The single-dose autoinjector device from AstraZeneca, called Bydureon BCise, has a continuous-release microsphere delivery system designed to provide consistent therapeutic levels of the active ingredient, exenatide, to help patients reach and maintain a steady state. Across 2 clinical trials, average HbA1c reductions of up to 1.4% and average weight loss of up to 3.1 pounds were achieved when using this device. The most common adverse reactions reported in patients in clinical trials were nausea and adverse events associated with injection site nodules. Results from a Phase 2 clinical trial published by The Lancet suggest that an OTC antihistamine may repair nervous system function in patients with multiple sclerosis, according to Specialty Pharmacy Times. The study was conducted by the University of California, San Francisco, which also provided funding, as did the Ratcliffe family. As myelin damage is sustained due to MS, neurons have reduced ability to transmit electrical signals between nerves, which leads to the loss of vision, weakness, walking, and problems with coordination and balance. Although current therapies aim to prevent additional injury, none can repair myelin damage. The investigators found that when patients were taking the antihistamine, signaling from the eye to the back of the brain was significantly accelerated compared with baseline, suggesting myelin repair. These Phase 2 findings are the first to show that an OTC antihistamine can restore human brain function damaged by MS, which is especially significant because participants had established myelin damage. Pharmacists may get more questions from parents about teen depression and anxiety after a video aired about this subject on the American Academy of Pediatrics YouTube page. The video, called "The AAP Offers Advice and Tips on Helping Teenagers," discusses early prevention and how to successfully treat teens who are suffering. For more information, visit aap.org. For more great coverage and practical information for today's pharmacist, visit our website and sign up for our daily e-news. And don't forget to follow us on Facebook, Twitter, and Instagram. Thanks for watching our Pharmacy Week in Review. I'm Nicole Grisano at the Pharmacy Times News Network.